Insulin resistance, fatty liver disease, diabetes, metabolic dysfunction, all of these are extremely common conditions that can easily be worked on, but ultimately will lead to mitochondrial dysfunction and oxidative stress. Now, what is insulin resistance? Your doctor hasn't told you you have it. Maybe you've been diagnosed with diabetes. Who knows? But did you know that 86% of the general population worldwide is suspected of having a metabolic dysfunction? What that means is that our bodies are not able to utilize the building blocks that we've talked about appropriately to create energy and sustain life. Now, most people think about metabolism or metabolic as just metabolism having to do with weight. However, it's bigger than that. It's not just weight. It's our energy stores, it's our cognition, it's our neurological pathways, it's our sensations and auditory system. Everything is part of our metabolic system. Now, you may have also heard that diabetes is correlated with hearing loss. And it is, but it's correlated. It's not causative. And one of the things that's driving me a little bonkers right now, I think the audiology community is trying to put the two together as one causing the other, which is not true. Again, we talked about correlated versus causative. This is just a correlated issue. Now, I routinely in practice look at lab work. Every single person whose labs I've reviewed have indicated that they have insulin resistance. So if you've sent me labs for tinnitus or Meniere's disease, I can 100% guarantee that you have some form of metabolic dysfunction. Now, insulin resistance, diabetes, fatty liver, metabolic dysfunction do various things to the body. Number one, they damage the microvascular system. This is why so many people have cardiovascular issues. Maybe you're on statins or different medications to treat your heart or your high blood pressure, but really it stems 90% of the time from a dysfunction in your metabolic system. If you suffer with neuropathy, loss of feeling, tingling, numbness, pins and needles in your extremities, which by the way, the ear is one of them, that is also a sign of metabolic dysfunction. And then oxidative stress increases significantly with metabolic dysfunction. Again, we talked about the cell and having those receptors on the cell for the hormones. Insulin is a hormone that comes onto the cell. If the cell is inflamed, the insulin isn't coming in, and so your body's not getting the glucose it needs to function optimally. What happens is that your body releases more insulin then to try and get it into the cell. There's a loss of this feedback loop because the cell is inflamed. Now, when it comes to tinnitus and Meniere's disease, metabolic dysfunction really affects the blood flow, the oxygen flow, and the nutrients going into the ear. If those pieces are missing, the ear, the auditory system in general, is not going to work right. This is the first place to focus. It's the easiest place to focus, in my opinion. It'll help resolve other issues that are going on. But in order to address metabolic dysfunction, you really want to begin to dial in your diet. Now, there's a couple of lab markers that I like to look at for this. I'm just going to tell you that the most important lab markers for this would be your lipid panel. And really, it's about the ratio of your lipids. It's not about the number, unlike what some doctors may think. You want your cholesterol to be between 190 and 210, 220. Your triglycerides should be half of your cholesterol level, and your HDL, high density lipoprotein, should be half of your triglycerides. And then we want to keep your LDL under 100. By doing some of the diet modifications that I have in the program here, you should start to see those numbers normalize as well. When it comes to glucose, the normative ranges for Western medicine are quite high. In functional medicine, ideal glucose levels, fasting glucose levels, is between 85 and 88. If you find that you are above 88 after you have fasted for about 12 hours, your insulin levels, your glucose levels are still high. That means it's not being utilized by the cells. I also like to look at AST and ALT. These are two other markers that I look at for liver function as well. But if your ALT and AST markers are above 20 to 23, that indicates that you have an overburdened liver. Likewise, if they're too low, that tells me that your liver's not processing anything. So there is an ideal range, and we'll get into that a little bit more within the community as far as diving into some of the labs. What I would like you to look at, if you do request labs from your doctors, I would like a full metabolic panel, full lipid panels, your CBC with differential. Things that can cause a messed up metabolic pathway that can lead to this insulin resistance and metabolic dysfunction would first and foremost be poor diet. It could be bad lifestyle. You're not sleeping well. You're eating too much sugar, too many carbs, drinking too much alcohol. All of these things lead into having elevated glucose and therefore elevated insulin levels. Now, you may also find that you, quote, are hypoglycemic. So how can this be a problem for you? Well, it's not so much the issue of high insulin. It's these spikes that are the most important. However, after those spikes, the body can no longer respond to these spikes in glucose and drops in glucose. It begins to just always be elevated. So hypoglycemia or low blood sugar is a precursor to full-blown metabolic dysfunction. If you find that you get grumpy after not eating for 2 or 3 hours, if you can't go a day without skipping all meals, without struggling, you have some sort of metabolic dysfunction. Other signs of metabolic dysfunction can be puffiness under the eyes, cherry angiomas, those little red bumps that kind of appear on the body. A dowager's hump is also an indication that you may have a metabolic dysfunction. Let me know if you have questions.